My name is Peggy Clark. I've had the very great good fortune of leading on Spotlight Health with my colleague Ruth Katz over the last few days. And what a really incredible few days this has been. If I could get everyone's attention for a moment. Thank you. From the beginning, our objective was to take health out of the box. And as Secretary Sebelius said, to connect health to issues such as economy, climate change, national security, design, our productivity as a nation, as a world. And as you know, at Aspen, this is what we love to do. And some people think we should be called This Connects to That. We really believe that breakthrough thinking happens when you put artists together with scientists, with doctors, with nurses, with policymakers, and see what kind of solutions we can come up with. So I think we succeeded at taking health out of the box. And this was largely due to you, largely due to what all of you have done, and I just want to tell you a few highlights of which you're going to see in a few minutes on the film. Niraj Mistry challenging us to embrace LWL, life well lived. Sam Cass taking us to get back into our kitchens and cook with love as a way to change our economy. Jane Otai telling us that the secret technology to solve climate change, food insecurity, and economic development is family planning. B.C. Alami telling us the story of how his friend Ibrahim's death of HIV/AIDS gave him the courage to stand up as the first gay person in Nigeria to publicly claim that they were gay. Catalina Escobar talking about teen pregnancy as it relates to violence in Colombia. Art Kaplan and Akaya Winwood talking about the ethics of dying with dignity. And in the many, many, many conversations with all of you in the IDEO.org Solutions Labs, coming up with ideas like an Uber app for healthcare in the Solutions Lab and in many other places. This has been a fascinating, fascinating journey for us, and I think we've together created a vision for health in 2024, which is incredibly hopeful and incredibly evidence-based and engages us all. I want to just take 2 seconds to give a shout out to a very small but very mighty Spotlight Health team. It was led by Ruth Katz and myself, but we had incredible colleagues, Britta Stevenson, the amazing Katie Drasser, my dearest colleague, Fran Marie Kennedy, who's here, Allison Levy, Dave Chotsky, Karen Frieden, Courtney Martin, John Carey, and Maya, our mascot. Kitty Boone, the Aspen Ideas team, you guys don't believe how amazing they are. They are incredible. Every morning, they get together at 7 o'clock, and they deal with everything. And lastly, to my colleague, Ruth Katz. I've been trying to get her to join the Aspen Institute for years. Her intellect, her compassion, her no-nonsense way have been an absolute joy to work with, and we have had so much fun. So Ruth, to you, thank you so much.
And Peggy, of course, all back to you. So last evening, I got home about midnight after having the opportunity to view the production that Anna Devere Smith put on last night at the Pepke Center on race and healthcare. And I sat down to prepare my few remarks and what are my most memorable moments. And as you might imagine, I went on and on and on. So this morning I arrived and I was told, just like those of you who gave us your 10 great ideas on Tuesday, that I had 2 minutes. So you'll forgive me that I've had to cut it down to about 5. And I underscored that these are among my most memorable moments because there are so many of them. But first, number 1, listening to 10 great ideas at our opening session from a widely diverse group of great thinkers and doers. And by the way, we had no idea what any of them would propose. And saying over and over and over again, wow. Number 2, watching people from all across the country and indeed all across the globe in informal conversations about those good ideas and dozens of others generated here and how, working together, we can help make them a reality. 3, seeing the director of the US CDC and the director of China CDC appear on the stage together, meeting publicly for the first time ever. While the political leaders of America and China may have big differences over trade and human rights policy, Their public health leaders are united in their commitment to fight disease and keep the world of nations safe and healthy. We have so much to learn from public health. 4, learning that people actually cried after listening to Riza Lovizo-More's talk on building a culture of health in America. They were truly, truly moved by what they heard. It makes me believe we can really do it. 5, catching up with some old friends and colleagues, developing new relationships. I know this must be on your own list of most memorable moments as well. And I want to add one just for good luck. Standing before you humbled, but also most delighted to say this was our very first time doing Spotlight Health. But thanks to our outstanding speakers and moderators, incredible support, as Peggy just said, throughout the Aspen Institute organization. And of course, thanks most of all to you for being here, for your enthusiasm, and for your participation in all kinds of ways. And actually, I've got to pause here to give just one example of how you jumped in from the very beginning. This morning, we received the following data from our friends at We Cycle. That's the bicycle group we worked with. Collectively, over the 3 days together, you took 384 bike rides, rode 705 miles, avoided 472 pounds of carbon emissions, and are you ready for this one? You burned over 30,000 calories. Pretty darn incredible. So for all these reasons and so much more, we will be back again. So we look forward to seeing you, same time, same place, right here next year. And now, before you run out, just give me 4 more minutes. Please enjoy this brief, very brief Spotlight Health video that we hope brings back your own special memories of these extraordinary 3 days together. Thank you so much for being here.
We hope that this, like an Ideas Fest, will have that spirit of interchange. This is not like other conferences where people get up and give talks and then disappear. This is supposed to be deep dive workshops. You're supposed to sit on the grounds here and really talk to people.
We live in an era of imminent social explosion where we need to focus on things that connect us as humans. And there is probably nothing that connects us more than 2 things. 2 things that transcend any material value and no limits in cultural, religious, or language barrier: arts and health.
But in my country, poverty, lack of education, lack of political will, and religious extremism by groups such as Boko Haram have impeded the delivery of good health care. But I still dream. And I know that as we work together, this dream will come true.
And in order for us to meet the need of those new people, the 2-3 billion more people that will be on this earth during the lifetime of my grandkids, we're going to have to increase agricultural production by 70% worldwide. To do that, it's going to require as much innovation in the next 40 years as we've had in the preceding 10,000 years.
So we start with shining a light on the problem, doing surveillance, tracking, seeing what the situation is, and trying to understand what the risk factors are for mental illness or for suicide or for violence or for other problems.
Poor families who cook have healthier diets than wealthy families who don't. Cooking is the way that we can get healthy, affordable food to everybody's plates.
And we came up with a 3-dimensional structure of this child's heart, and we were able to provide the surgeon with the exact view that he or she would have as they go in, and so they can plan this surgical approach in a very precise way.
So if we're going to change outcomes, we're going to have kids who are going to be performing well in school, we're going to be healthy, we're going to be in a healthy community, in a healthy environment. How could we create it as a community? And this last piece to it, I think, was also, how could we create it so that it could be replicatable?
Building a culture of health is going to take all of us working together towards a common goal. It's going to require new partnerships. It's going to require us to stand on the shoulders of others and turn small victories into national successes. We can do it if we spotlight and support those initiatives that are working and then learn from those that aren't.
We're saving more people than ever before. We've had 22 successive years of decline in age-standardized cancer mortality rates. 1.3 million people will have a birthday this year that wouldn't have had otherwise.
We don't take collective responsibility for each other, and I think that's where it starts.
And how do we ensure that the confidence level of all consumers of health in our country remains high, and that we can deal with the quality and the cost implications of all this in a meaningful way?
There's two different worlds. The world of ideas that are not put into action. It's happening in Kenya, where the UN Habitat build houses, the government, nobody lives in. They didn't consult us. There's a culture that's going on in the communities. So my advice is that let's all leave our box and talk to the people.
These kids that are now getting this new drug based on the genetic diagnostic marker are actually now getting off the transplant list and getting onto the soccer field.
So when I walk and I stand tall in front of you, it's emotional for me too. A nice role reversal's happening. I'm standing and you're all sitting.